Welcome to another episode of United for a Healthy Stoughton. My name is Stephanie Patton and I'm the Prevention Coordinator for the town of Stoughton. And today we're going to be talking about new tobacco laws here in Stoughton. And I am very excited to have with me two guests on the show today. I have all the way to my left, Larry Perry, who is the Director of the Stoughton Health Department. And to his right is Cheryl Sbarra, who is the Senior Staff Attorney for the Mass Association of Health Boards. So welcome to the show. Thank you both for coming. So the reason that we wanted to do this show today is because we have two brand new tobacco policies coming online on March 1st, really that are aimed at protecting our young people from the tobacco industry and some of their marketing tactics. But before we jump into that, I want to talk a little bit about boards of health and sort of how they operate and how they might look and feel a little different than other boards in the town, because I think some of our viewers might wonder about that as well. So I thought maybe we could start, Larry, with you, where you could tell us a little bit about what the Stoughton Board of Health does generally, and then we can talk about how that board operates differently than, say, the planning board.
Sure, Stephanie. Yeah, boards of health vary quite a bit. I mean, a board of health in general is very diverse, and each community is different. I've only been here almost 2 years, but I come from a whole different community. I was in Lakeville for 14 years, very agricultural, large lots, a whole different set of problems. The Stoughton Board of Health, it's a little different here. We have a little more city problems, even though we're not a city. But for instance, 40% of the town is on septic, whereas 60% approximately on sewer. So that's a big part of our job, is permitting new Title V septic systems. We have quite a few more restaurants here than we did in Lakeville. Food safety is paramount importance. We permit all the food establishments. We do foodborne illness investigations. Housing is a lot different here too. We had a very rural community with single-family homes, and here we have a lot of apartment communities, condo communities. So we answer complaints for housing. We have some seasonal public health issues like swimming pools and beaches. The Board of Health oversees inspections of pools and beaches, recreation camps. That's all seasonal. We do year-round. We do plan review for all the new projects in town. Not just septic systems in private well locations, but commercial businesses, new developments. And I mean, overall, we do groundwater protection too. Even though conservation does a lot of that, we have an environmental affairs officer that works on that. I'm situated in the engineering department, where we all kind of work together for these and other problems.
And you do all of that with a department of how many?
Right now there's three of us in the health department, and we have a 5-member board.
So the board are all volunteers, and then the office staff are the folks who have to execute really all of the things that you just said.
Correct. We're the eyes and ears for the board. We do the daily inspections, the administration, the permitting. And whereas we meet with the board once a month, and they promulgate new regulations, they can grant variances to regulations, but their role is a little different than we handle the day-to-day stuff.
Right. So maybe, Cheryl, you can talk a little bit about sort of the board itself and Mass General Law and how that functions differently than like a planning board.
Sure. I would also just add that the health department is also responsible for communicable disease reporting and following up on communicable diseases in the municipality, which is another really important role they have. And if a board of health and a health department are operating appropriately, following standard operating procedures, doing everything by the book, doing their inspections, their enforcement, their follow-up, then no one in the municipality will have heard of the Board of Health, because everything is going the way it should be going. No one's getting sick in restaurants. No one's getting hurt in housing. You know, things are going the way they are. So it's really, to an extent, it's sort of it's a silent task that boards have if they're operating appropriately. One thing that's unique about health departments and boards of health that is not the same for other departments in a municipality is that the Board of Health has the legal authority to enact local laws relative to public health. That authority comes directly from the legislature. So, and that authority has been upheld by the Massachusetts Supreme Judicial Court time and time and time again. As long as the regulation is reasonable, then the court will uphold it. It will not, a court will not substitute its judgment for the judgment of the Board of Health. And this sometimes presents sort of a natural tension between laws that are passed by boards of health and laws that are maybe passed by, in Stoughton it would be town meeting.
Right.
Because town meeting is the legislative body of the town.
Right.
Although the Board of Health has the same legislative authority when it comes to enacting local public health laws. So that's something that's not always understood.
Right.
And it's also something that does create tension, but there's really a great reason for that in the fact that these laws can be passed on a quicker pace than bylaws usually are, or than state statutes are. And
Right.
we have 351 local boards of health in Massachusetts, all of whom have this exact same authority.
Great. Excellent.
And frequently what happens with these laws is when we get to the tipping point, when we have enough cities and towns that have enacted local public health laws, the state legislature then steps in.
Right. So an example of that might be the Tobacco 21.
Tobacco 21 is one example of that, and the prohibition of tobacco in pharmacies is another example of that.
Great, great. So let's talk a little bit about specifically the tobacco regs that we recently passed through the Board of Health, and we can talk and use that as an example of how the board passes local regulations through their meeting structure and public hearing and that whole thing. So maybe Larry, can you explain, and sort of in plain English for the people at home, what two policies really are going into effect on March 1?
So basically, the biggest issue was the flavored tobacco products and the flavored, the vaping oils, which were anything with flavors is basically targeting kids. So we wanted to move those to the over 21 shops, and that's the biggest thing they're going in. And the capping, we're putting a cap on the number of establishments. Right now, we have over 3 dozen retail establishments that sells these products, and 4 smoke shops. But we're capping that, and there's going to be no more. Not an increase in the number of retail establishments selling these products, and they're going to be strictly limited to the over 21.
Great. And the way that this happened is that the board initially heard from the Oasis Coalition, which was one of the constituents who sort of brought some of this stuff forward and looking at what some of the best practices were across the state, and said there are some, actually we have a slide for this, there are some regulations that have to do with youth tobacco prevention that are recommended by the Mass Tobacco Control Program, MTCP. And there are 6 of them, and we actually had 4 already. So Jeff pulled these up on the screen for us. They have to do with prohibiting the sale of cheap single cigars. We've done that here in Stoughton a number of years ago. Restricting the sale of flavored tobacco products to adult-only retail stores. So that's one of the new ones going into effect. Prohibiting the sale of electronic cigarettes to minors. So when we moved the the sale of retail tobacco products to 21, we included e-cigarettes. In fact, the board a while back included e-cigarettes in all of its definitions. We need the next slide. Thank you. We're capping the number of retailers with a license to sell tobacco here in Stoughton. So that's also one of our new regs. We've prohibited the sale of tobacco products to minors under the age of 21. And a while back, we prohibited the sale of tobacco products in pharmacies. So these are currently some of sort of the gold standard policies that the state's looking at and really encouraging communities to do. And so what's really great about this is, as of March 1st, we're gonna have all 6, which is exciting. And so let's talk a little about the process that it took to get there, because it took a little while. It wasn't just kind of an overnight thing. So do you want to talk a little about, Larry, about kind of how the board sort of heard this, what happened, kind of what the story was?
Yeah, we had a number of meetings, and which you were present.
Yep.
And anytime we enact new regulations, you have to bring the community in, and there's a public hearing involved, and the retailers came in. We had students come in. It was a long process over the year, lots of meetings, but the state has kind of gone this way too. Cheryl could probably talk about that more. How all these things are everything from taking them out of the pharmacies to the prohibiting the sale of single cigar. All this is, the whole state is going this direction. I think it's gone from, I don't, what is it up to, 60% now? Or?
We have about more than 142 cities and towns that have restricted flavored tobacco products to adult-only retail tobacco stores, which is about 65% or so of residents in Massachusetts live in one of these municipalities. About 40% of residents live in a municipality that has capped the number of retail tobacco permits. And one unique, very proactive thing that Stoughton did was to not only cap permits, but also when a retailer sells his store, and for example he sells it to someone who wants to turn that establishment into another use, like a dry cleaners, for example, then that permit gets permanently retired by the Board of Health. So while it's a long-term density strategy, it's still a very proactive strategy because it effectively eliminates that permit. And one of the goals is to hopefully make that permit more valuable to retailers so that they are less apt to sell to anyone under the minimum legal sales age because the permit is valuable.
Right. And one of the things we learned when we were looking into the capping policy is we learned that Stoughton actually has a higher number of tobacco retailers per capita, so it's like per 1,000 residents, than the average in Massachusetts, which was sort of surprising. I don't know why or how that came to be, but
it is surprising, but it happens.
Right.
In communities where you wouldn't think there would be as many, there are a surprising number here.
Yeah, so that was an important piece for us to sort of take a look at, and I think we were having a lot of vape shops open, which was really one of the impetuses for us to begin to look at this policy, because people were asking questions about how can these stores come in, and their reason was there was no cap. I mean, there was no reason for the town to say no to these particular retailers. They were a business like anybody else. So this allows us to really be, at this point, we couldn't have more vape shops and we can't have any additional tobacco retailers, and we can only sort of reduce, which is, I think, like you were saying, it's really outlet density is an important strategy for prevention of alcohol, prevention of tobacco products. When we know we have a lot of these things in the environment, our young people are more apt to use these particular items. So let's talk a little bit about the flavor restriction, because that was where there was the most pushback. It was the most controversial of the two policies. The cap went through, really nobody questioned it. There was not a lot of conversation about that at the public hearing. The board presented it, they talked about it. I don't think anybody came out against that particular regulation, but there was a lot of controversy around the flavoring restriction. And as a coalition person, a prevention person, we went back and we looked at the data originally and we said, wow, our kids, and I know we have a slide about this, are using the electronic cigarettes more than other drugs in the community. So here's a good example. So when we look at the difference between sort of cigarette use, which are the green bars, and electronic cigarette use, which are the orange bars, you can see we're doing really pretty well with our cigarette use. Actually, I take that back. I'm reading the slide wrong. The cigarettes are on the left. So our cigarette rate, for example, for our Stoughton High students is down to 7%, which is great. And so, really most of our kids are not smoking cigarettes anymore. 28% of our students at the high school had reported in the year, or actually in their life prior to the survey, which was in 2017, they had used electronic cigarettes. And so in 2017, that was the first time we surveyed for vaping devices. So that was, that number was not surprising to us, knowing what we know about the state, which are the bars in blue. We're doing better than the state, which is great. We just surveyed again this year, but this is again from 2017. You can see compared to other drugs, electronic cigarettes has actually surpassed marijuana use. It's more kids are being exposed to these products than lots of other kinds of things, second only to alcohol, which is also legal for adults. So it was a concern here locally, certainly in the state and in the country, for us to begin to look at this product and to think about how are kids getting these things. They are legal for adults, and so they're available in the community. They are prolific in convenience stores. The vape stores are opening also, so we know we see those in the community. Kids see those shops as well. They're getting exposed to these products alongside all the other kinds of things they love to buy in convenience stores, like candy and Doritos and chips and soda and other things that maybe are not so healthy for them either. But and a lot of these products are fruity flavored or candy flavored, and they are very attractive looking. And so that was one of the reasons we really felt like as a community we wanted to think about what policies are there out there that can help us address this issue. We're doing a lot of other prevention work related to electronic cigarettes, but we know policy change is particularly important. And lots of folks in the state are looking at this as well.
Yeah, and I would just add to that everything you just said, Stephanie, has been captured in the U.S. Surgeon General's report when the Surgeon General really looked at how the industry really markets its products. And the industry spends approximately 94% of its marketing budget in convenience stores. And if you do a GIS mapping of where convenience stores are in your municipality, you will see plenty of them within walking distance of schools.
Yes, yeah.
The industry knows that kids frequent convenience stores many more days per week than adults do, unless you're an adult smoker.
Right.
So they're in there, they're being exposed. And they're being exposed to a lot of cheap, sweet products.
Right.
There are some adults, but there aren't many adults that go in to buy a 59-cent bubblegum cigar. Stoughton addressed that a couple of years ago in their cigar packaging regulation, but we know these products are targeted to kids. The reason we know they're targeted to kids is because when all the attorneys general sued the industry to recoup costs for Medicare and Medicaid related expenses 100 years ago, I think it was only 20 years ago or whatever, during the court process, we were able to discover internal documents from the industry that clearly stated kids like sweet flavors.
Right.
Kids are our replacement smokers. We need to have them they need flavored products first before they are ready for something that does not have a flavor in it. So we're basically just what the FDA did in 2009 when they prohibited the sale of flavored cigarettes. They did it on the basis of what the industry said in their internal documents. What cities and towns are doing now in Massachusetts is just taking that one step further and saying, yeah, you targeted them, you stopped selling flavored cigarettes, now you sell flavored little cigars, and now we obviously have vaping products now, which I don't know if you're aware, but Philip Morris just bought, I think it's a third of Juul, to the tune of about $38 billion. There's a reason for why they did that. And now we have an outcry at the federal level as well with Commissioner Gottlieb from the FDA saying, this is an epidemic. We've got to get rid of these e-cigarettes, especially the menthol ones, because they're the ones that the kids are buying the most, according to a report done by the Campaign for Tobacco-Free Kids. So it's a huge issue. They're acting just like they did when they were marketing flavored cigarettes, and really policies are one of the most important tools for trying to address this, what is now called an epidemic.
Right. And I think what you just talked about really helps explain some of the tension and the pushback that we were experiencing locally. So one of the arguments sort of against doing this regulation was the convenience stores felt like they were being singled out and that they were working really, really hard to card young people and to prevent them from buying these products. And we know and we believe that our local convenience store owners are absolutely doing the best that they can to do that. That they have the young people's interests at heart as well. But we also know that the research says that kids are able to get these products by and large at brick and mortar stores like convenience stores, and or from other social sources. But really, the research says they're really able to get these things themselves. So. We need to address that. And you had talked about that convenience stores. And so here, Jeffrey brought up some of the research from the Truth Initiative about, where kids report that they were getting these devices. This is a national survey, so this isn't Stoughton data per se. But I think that some of what you were talking about in terms of just exposure in these stores and the marketing tactics being used by the industry through convenience stores, which the convenience stores really can't control, is really what the crux of this issue is and why we felt like we had to intervene with a policy.
Yeah, and that's one of the pushbacks that I'm sure you received. Now we're hearing another pushback is, are these vaping products actually harm reduction devices? Do they really assist a smoker in enabling him or her to quit smoking? And when you're looking at public health harm reduction strategies, you have to do a balancing test. You have to look at how many adults truly are able to quit by using an electronic cigarette. And what we're finding, and that we need to do more research on this, but what we're finding is that a lot of adults use e-cigarettes when they can't smoke. So they're not quitting with them, they're just using them as an alternative. And then we're also finding that, and we know now that youth use of these products is skyrocketing.
Right.
And these products have more nicotine in them than, they have the amount of nicotine in them is the equivalent to a pack of cigarettes.
And I think, yep, here's an image sort of showing that. Yeah.
Yes, and it's interesting. Scientists in the UK did a study on whether these products were actually harm reduction products or not. And what's interesting is the products that they were studying didn't have half the nicotine in them that Juul is allowed to sell in the United States.
Wow.
So the study doesn't really do much good in our analysis because our products have so much more nicotine in them than they did.
Right.
But if you're looking at the epidemic of kids using and the anecdotal stories of some adults maybe being able to quit, that's not a harm reduction model. That is just not, blatantly not a public health harm reduction model. In addition, Stoughton's restricting these products to adult-only stores. An adult can go into these stores and get these products. They can also get them in the convenience stores if they're not flavored. So, you know, we're not preventing an adult from doing this. But calling it a harm reduction policy when we see what's happening with our youth is really disingenuous in my opinion.
Great. So this is so interesting. I feel like we could talk about this for a really long time. You know, one of the other pieces of pushback I think that we had also heard from the industry folks was that that this isn't a problem that the convenience stores or sort of the brick and mortar stores should have to solve, that this should be an enforcement issue with our police department. And I know we read that in a number of places, and there have been a number of studies that say that you know, going out and enforcing kids vaping, I mean, one, we know, like, realistically, like, that is not, that's not on the radar for the police department when they have lots of other stuff that they need to deal with, but also that it really just, as a policy, doesn't work.
And it doesn't. And what was interesting in Needham, and I know in other municipalities as well, the police chief has come in and testified that these possession laws, they're called PUP laws, are ineffective, especially in light of the newly enacted Criminal Reform Act, which makes these tickets basically nonsensical. So it's a complete red herring to punish kids for an industry that's purposefully targeting them. But when you have law enforcement telling you this is not going to solve your problem, it means nothing to take it anymore in Massachusetts. It's again a disingenuous argument, or an argument not based on facts.
So the good news is that the Board of Health unanimously made these decisions to sort of move forward with these policies. And we know that here in Stoughton, we will start to see that roll out on March 1st. So as of March 1st, there should no longer be any of these products available in the convenience stores. They will be restricted to these 21 plus stores, of which there are 4 here in Stoughton. So if there is an individual who is looking to use these as a smoking cessation device, or an adult over 21 who can legally purchase these products, that's where they're going to have to be looking. But that our young people are not going to be sort of faced with these products any longer in the convenience stores and being kind of enticed by the way they look. And, you know, we saw in some of the imagery how appealing these are. These products, a lot of them are designed by, you know, the same people who design iPhones, right? And they look really sleek, and they're kind of fun to hold, and they smell really good, all those fruity flavors and the various, so here are some of the juices. And in fact, you know, oftentimes kids, because of the flavor, sort of masks the concept that there might even be nicotine in there.
Right.
They really think I'm having some mango e-juice, you know, but we know that all of these products have nicotine in them. And so I think that that's really important. The other thing, and I know we're starting to really be close on time, but just to, because I know this came up at the Board of Health, is there was a conversation briefly about the possibility of a compromise. What if we could move these products behind the counter? And I know that there's a legal reason why we can't do that. And so
right, if we move the products behind the counter, we can be accused of violating the tobacco industry's First Amendment right to commercial free speech. In the United States, companies do have a First Amendment right to commercial free speech, unlike in Canada and in some other countries where this has actually happened. Large graphic warnings behind the counter, covered with a black curtain. Those are not options that are available to us in the United States, specifically in Massachusetts and in Stoughton.
Right. So we couldn't put into policy something that with language like that, because the tobacco industry, sort of above and beyond what anybody locally would maybe agree to, the tobacco industry would probably sue us.
Absolutely.
Right. So I think that's an important piece as to another reason why these policies are just really important to help protect our young people from kind of some of these predatory tactics, really, that the industry is using to try to hook them on nicotine early. And we know a lot of kids who use electronic cigarette devices actually progress to cigarettes ultimately, which is the other piece of research that is out there. So I know we are like literally at the end of our time. So I'm going to have to, unfortunately, say thank you to both of my guests. And I really appreciate Cheryl and Larry both coming on the show today. I think the time went by really fast, super informative. Thank you to the Board of Health for pushing forward these regulations. I think it's great work. Thanks to SMAC for hosting us and filming the show. And we'll see you on the next episode.